welcome. And we're going to get started. We are expecting a couple more people, but we're going to get started because we really have a lot of wonderful people here who will be able to exchange ideas. And I'm going to introduce Dan Holden, and he's going to tell you a little bit about himself, and then we're going to get into the program and have everybody introduce themselves.
Hi, I'm Dan Holden. Look, some of you know me. I am a cancer researcher. My field is tumor immunology, but I actually also have gotten very involved with the patient advocacy society, cancer advocacy society, and trying to tackle the major issue of cancer, showing up with people. So as a scientist, I see that there's more than just a cure. You've got to produce it. You've got to, you've got to find the basic discoveries. You've got to bring them through clinical trials. You've got to bring them to the final result of the product. I've been everything from basic research to translational research to clinical trials. So I'm familiar with that aspect. I know how difficult it can be. So part of what I'd like to do while I'm in Arizona is to see if I can improve and get some of that process moving more so in Arizona. It's right now an underserved area, and there are also populations of people who are underserved. So it's another outreach that we have to try to get everybody, as many people, patients as we can, involved in the benefits of clinical trials. So those are some of my priorities and some of the things that I'd like to bring to the team.
Thank you. I'm going to go around the room because everybody's kind of coming literally from a different place, and I want to hear, what you're doing. We are going to be talking about some of these issues tomorrow, but not in the way we can here, where we can really get into more of a dialogue, because we have to cover a number of other topics, and we have to be very focused, of course, on myeloma. And even though that is our, for us, our major concern, for me, my concern also is about how we can have better collaboration, more research, and more partnering. So, say hello there.
Hi, I'm Teri Landowski, and I'm a PhD scientist at the Arizona Cancer Center in Tucson. I'm in the therapeutics development program there, and the primary focus of my research for many years has been multiple myeloma and, to some extent, other B-cell malignancies, such as lymphoma. I don't know what else I can tell you. I do primarily drug target development, preclinical, not closely aligned with the translational program at Arizona. And basketball fan, and we're playing Louisville now, so if anybody has an iPhone with updates,
that's probably rejected right now.
My DVR is recording it now.
Okay.
Arizona's Cinderella, but I do have my phone in my pocket if you really want to.
Well, we have time report.
Okay.
All right, excellent.
Okay, my name is Judith Finley. I have a PhD in biochemistry. I'm the technical director at the Binding Site. I'm based in San Diego, and the Binding Site is a company that makes a serum-free light chain assay that's used now for monitoring multiple myeloma. It's also useful for prognosis and for screening and detection of the disease. So that's what part of my job is to go out and educate doctors, patients, and laboratorians on how the test is used.
My name is Mary Beth Montague, and I'm on the board of the Arizona Myeloma Network. And I met Barbara through the tissue donor awareness program that she has, because I used to collect tissues at St. Joe's for their tissue bank. And I've been involved with clinical trials for a long, long time. And the other day, the Clinical Trials magazine came. It has an article about tapping into patient organizations. Now, I know there's HIPAA regulations that people would have to look at. I haven't read the article yet, but I think that's kind of where things may be going, or along those lines. So I'm sure it'd be very well suited for, exactly what we're talking about here. So probably since we're all in educating, and this is a collaborative effort, I'm sure if I PDF'd it to everyone, it would certainly fall within the copyright law. So if I find that it's an interesting article, I will pass it along to everyone. Great, thanks.
I'm Jim Fornaday, and I'm a commercial developer here. I'm not a scientist. My father and I built a research laboratory at the Mayo Clinic where we have a fine myeloma research lab, of course. And that's ultimately how I met Barbara, and then became a board member this past year. And this past year, I also became a board member at the Arizona Cancer Center. And I know Dave Roberts and Tom Brown really well. So we're focused on trying to help their efforts in developing more clinical space in Arizona County as well.
My name is Coach Johnston. I work for Millennium Corporation. Millennium is the manufacturer of a drug called Velcade that is one of the primary treatments used in multiple myeloma. We have a number of other a fairly robust pipeline coming down looking at other forms of cancer as well. As the MSL, my role is one that I work with the investigators in the area. I focus primarily on Phoenix and Mayo Clinic and City of Hope, helping them develop clinical trials for use at their site that we can then support in a way, either through funding or other ways. So that's my role, and I'm fairly new to this region, so it's nice to thank you for inviting me, Barbara. It's nice to meet up everyone.
My name is Michelle Morgan Flowers. I'm the utilization discharge planner for the Ft.defiance Indian Health Hospital up on the Navajo Reservation. I came down a year ago and had the honor of meeting Barbara, so we've been collaborating on some exciting projects that are coming to Ft.defiance. We were able to host our first Ft.defiance Cancer Awareness and Advocacy Conference in October. And we're looking at doing our second one in July, which I think is going to become a 3-day event. We've been able to network with a lot of programs in the area. We're about 5 hours north of here. So I took off yesterday. My kids and my family are here with me. We've networked with John Wayne Cancer Foundation. We're also working with Rosalind Carter's Institute now. Coleman, we just got a Coleman grant. So there's a lot of things that have been going on. And we want to thank Barbara for inviting us here this weekend and for working with my family and myself and bringing awareness to the Navajo people. And that's why I'm here.
Good evening. My name okay. My name is Bertha Harrison. I'm a full-blooded Navajo. I'm from Ft.defiance. And I work with Michelle at the Ft.defiance Indian Hospital. My program is with the Navajo Nation, and it's called the Navajo Nation Breast and Cervical Cancer Prevention Program. And I'm just part of Michelle's group here, committee. She invited me.
Yeah.
Okay. In Navajo, She'e Bertha Harrison, she has Lloyd Papa and Sean Touching, Christian. This is my clan that who I am, and I'm just saying that I'm with my mom is the Meadow People clan, and I'm born, my paternal father is with the Tobacco People, and that's how I'm introducing myself. And we introduce our Navajo paternal grandparents and our paternal grandmother or grandfather, and that's who we are. So my paternal grandfather is he's Apache born for the adopted into the Navajo people, and my maternal grandfather is of the Coyote people. That's my whole clan around. So that's how we introduce our program, and that's who I am from the Navajo Reservation.
That's Dolores, and you can say Dolores.